Hey guys, it's AG with Hurst Review Services and nursingforall.com. Have you ever wondered why you could learn some subjects easier than others? And did you ever stop to consider how the material was being presented to you when your learning was at its peak? You may have even tried to fit into a mold and learn the same way that other students were learning, or attempt to learn the same way that you have always been guided to learn. However, we know at Hurst Review Services that whatever worked for you in high school, and maybe even in your prerequisites, is not going to necessarily work for you in nursing school. Memorization, which is a very common method of learning, often causes nursing students to fall short of the grade that they really want or even need to be successful, because learning in nursing school requires a higher level of thinking. But guys, there's some great news. The brain was not simply meant to memorize. It's also made to analyze, which is exactly the type of learning that you need to be successful in nursing school and your higher level courses. Now, as we explore the concept of learning, you first need to understand that your brain is very different from the next student, and all students learn in very different ways. Now, determining the way that you learn best is crucial for your success. Felder and Brent in 2005 remind us that as students, we bring many different experiences to the classroom, including things like our background, our motivations, our interests, our ambitions, our strengths, and our weaknesses, and techniques for studying. And it's also about your responsibility. We may also recall at times that we learned something that maybe went into our long-term memory bank, and we were able to recall this information and use it later, and sometimes it's easier at times than it is at others. Those are the times that you were using your brain the way it was meant to be used. Our brain is so very complex, and we only use a very small portion of it. And guys, you'll be surprised at how much you'll be able to recall things easier when you use the right neurological pathways to facilitate your learning. The skill used most in nursing school for learning is called language processing. You use this skill when you listen to lecture, when you read a textbook, when you take a test, when you study for a test, and even writing those dreaded research papers. However, every student may have a different preference for how this language processing occurs. The degree of learning can be impacted not only by your aptitude and your preparation, but also by the style of teaching the instructor uses and even your individual learning style. Now, some of the primary learning styles that are widely recognized include visual, auditory, kinetic, and musical. Guys, it is important for you to understand that there is true value from finding your own unique individual learning style, because it helps you to use the right neurological pathway for optimal learning. Therefore, investigate how you learn best. Recognize what type of learner you are, and then seek ways to promote this style of learning. Guys, it is amazing how simply doing these few things can enhance the learning process for you, allowing you to not only memorize, but to be able to recall and analyze the information as well. Whew, what a winning combination. Guys, that is all we have for you here at Hurst Review. We hope that you would like, subscribe, and follow Hurst Review on all of your social media channels. And be sure to tune in every Tuesday and Thursday for more NCLEX tips and nursing topics. Peace out, players.